Ngā mihi nui ki a koe. Tēnā koutou katoa. I'm here today to talk to you about counting and countering the infodemic, COVID-19 disinformation in Aotearoa, New Zealand. Before we start, I'd just like to acknowledge that we live and work on the unceded lands of Ngāti Whātua Ōrākei. I'd like to introduce you to my disinformation project team. The team consists of myself, Kate Hanna, I'm a cultural historian, my colleague Giulio Della Riva in Canterbury, who's a data scientist, Andrew Spall, who's a statistician and data visualization specialist, M. Dentith at the University of Waikato, who specializes in conspiracy theories, Max Saw, who specializes in science and technology studies, Victoria Smith, who also specializes in science and technology studies, and then we have Dan Barnett, who also works in statistics and data visualization. So it's a really mixed methods, multidisciplinary, transdisciplinary team that we've brought together to look at the infodemic in Aotearoa, New Zealand. We're also part of Te Punaha Matatini, which many of you may have heard of. It's a centre of research excellence hosted by the University of Auckland, but which spans all of the New Zealand universities and many private research institutes and Crown Research Institutes. Now, we're a really unique research centre in that we are highly transdisciplinary and highly diverse. You'll see on the slide that 50% of our researchers are women, which is quite unusual in the computational science fields, which most of our people come from. And you'll see from some of the comments I've put up there on the slide that when we were recently assessed by an international panel for refunding, which we were successful in, that they commented on the diversity and inclusivity of our research program and of the team, and thought that that was a really special feature of the kind of work that we're able to do, bringing those different perspectives and lenses to bear on some of the most pressing issues of our time. So the infodemic. What is an infodemic? Now, the World Health Organization classify the infodemic as the plethora of information which coincides with something like the coronavirus pandemic. And what's important about the infodemic is that it is both trustworthy and reliable information and untrustworthy and unreliable information. And it's really important to also note that the infodemic takes place in situations which are different in each international situation. So the New Zealand infodemic is different from infodemics in other parts of the world, just as the pandemic itself manifests differently in different situations. And those localized, contextualized aspects to the New Zealand infodemic, what I'm really interested in talking to you and sharing with you today. Now, science communication is something that we in Te Punaha Matatini take really seriously. And it's something that we've been noted for during the period of the pandemic in New Zealand. And I just need to highlight to you some aspects of science communication during a crisis. Probably most critical for this audience is the need for that communication between experts, policymakers, decision makers, and communities to be trust-based, to be more ad hoc, to be less organised, to be able to be nimble and quick and respectful. And to also note that every expert is always bringing their own value system to the expertise they're displaying. One of the other things that we often talk about when thinking about the infodemic is an issue called debunking, which is, if people are spreading bad ideas, rumours, falsehoods, isn't it better to confront them, refute the bad idea? And one of the things we've really tried to emphasise during the period of communicating our expertise over the period of the pandemic has been that debunking is really not a great way to start. It is better to start from figuring out where shared values, shared worldviews, shared concerns, shared languages sit and reside, to think carefully about language, about metaphor, about image, and how these things have different contexts in different locations and different places. So the message on debunking is don't debunk, stop. So one of the things we've tried to really emphasise in those trustworthy and reliable communications of expertise has been the idea of kindness. And that's been something that we as experts within Te Punaha Matatini, have tried to emphasise, but it's also been something that we've noted in our research about New Zealand's successful response. We all know the messaging around be safe, be strong, be kind. Those images of the traffic information above the lanes, above the harbour bridge saying, stay safe, be kind. And that kindness is a really good starting place for both trustworthy and reliable information, but also dealing with the converse, with that untrustworthy and unreliable information. New Zealand had, as you all know, a really clear set of places where people could go to for trusted and reliable information. There was the Unite Against COVID multimedia online, on Facebook, on Twitter and on Instagram that communicated repeatedly critical messages for public health warnings and health and well-being, but also messages around kindness, about supporting each other, about mental health. And we also had the daily stand-ups, which became a really critical feature of the ways in which New Zealanders understood the infodemic. Dr. Ashley Blomfield and the Prime Minister Jacinda Ardern were some of the experts who helped interpret the infodemic for most New Zealanders and who provided that trustworthy and reliable source of information that people need when they've been overwhelmed by a plethora, a tsunami of information about something which is highly complex and is changing at all times. And some of the features we noted about the daily stand-ups were those really strong repeated messages and some of the types of metaphors that were used. There were a lot of metaphors and messages around being part of a team, sporting metaphors, but also military metaphors about battles and uniting together on a united front. And those types of metaphors are ones that people are familiar with from cultural references and from the ways in which New Zealand culture has kind of been reinforced over the last couple of 100 years. And so they really resonate with New Zealanders, and they provided a great touch point during the period of the infodemic. Oh, my slide is not moving. There we go. Sorry about that. Would have been totally my technical difficulty, not the team's technical difficulty. So what we ended up with was the sense of the government, the public health system and the scientists being part of a collection of people who could be trusted to provide reliable information during the period of the pandemic. And here we have a beautiful image by a 12 to 13-year-old young woman called Brianna, who drew this of those people who she saw as being part of the team who were telling us what was trustworthy and reliable during the course of the main part of the first lockdown. But we had at the same time issues with disinformation, misinformation, malinformation and conspiracy being present in New Zealand social media and mainstream media. Now, really briefly, misinformation is information which has been shared, which is incorrect, but has not been created with any kind of ill intent. Disinformation, on the other hand, has been created with the intent to disinform people, to disarm people and to deceive people. Malinformation is the use of correct information, but to harm people or organisations. And conspiracy takes the form of focusing on particular salient facts as the only correct explanation for a situation. And we saw features of all four of these present during the New Zealand infodemic, which we're still living through. So one of the things I wanted to note to you all is that disinformation, like the infodemic, doesn't take place in a vacuum. It's not the same everywhere. And in a New Zealand context, disinformation meets people where they're at with their lived experiences. And so when we have people who have differential experiences of health systems, differential experiences of state interventions, differential experiences of the notion of racism, of colonisation, then these mean that some parts of disinformation narratives might resonate more with some parts of the population than with others. So it's really important to understand that deep, situated Aotearoa New Zealand context for the disinformation that we're exploring and studying. So what we did was, over the period March through to the present day, we measured the volume, the amount of reliable or unreliable sources that were being shared on social media in New Zealand. And what you can see on the slide that's in front of you now is that during the period March through till just before the Auckland August cluster, over a period of different lockdown levels, so when you might have expected some quite great different variation in the amount of sharing, with more people being at home or more people being in front of the internet, is that actually there was pretty much a static level of the amount of disinformation, so the amount of unreliable or reliable sources present in social media sharing. We looked again specifically over the period of the Auckland August cluster, and while there was a lot more sharing of information, so the volume of information in total was a lot higher, that line stayed relatively static still. So the problem was not at that time that more people were sharing more disinformation on social media, but there was a lot of concern about disinformation, if you recall, back in August and September, with even the Minister, Chris Hipkins, mentioning it in one of the stand-ups during the Auckland August cluster. So what was actually going on? Well, we looked at mainstream media too, and you can see here on this slide that there was a large uptick in August and September in mainstream media mentions of notions of conspiracy and disinformation. Now, this preceded the beginning of the Auckland August cluster and started to increase as the Auckland August cluster period of lockdown continued. So what we can conclude from here is that there must have been more external factors at play. When we looked specifically over the period of that level 3 and level 2.5 lockdown, you can see it does start to die away again and come back to more of the level that had been throughout the whole year. But during that peak, August and September, we really needed to understand what was going on. So what we looked at is a large-scale, rich, collated text discourse analysis of the types of material that were being shared on New Zealand social and mainstream media. And we categorised these into some key meta-narratives. So a meta-narrative is just a big story. That's all it is. And those key meta-narratives were centred around distrust in government, the origins of the virus, disbelief in the virus itself, and then health and well-being outcomes. And then we looked more closely at what we called narrative change over time. So here we have looking at those virus impacts of the virus type narratives. And you can see that between March and prior to the August Auckland cluster, most of the narratives were about things like, we don't really know how many people are dying with the disease, maybe people are dying with it instead of it, only affects the elderly, those sorts of narratives of minimisation of the impacts of COVID-19. And then that changed in August and September to be more concerns around the notions of herd immunity and some of the other scientific or pseudo-scientific discussions that had happened internationally around the virus itself. Oh, sorry, I'll go back. And then we looked at narrative change over time with some of the other themes. So these are really interesting and of real concern to me and the team. So you can see with the virus origin narratives that what you have is in the first part of the period, we have quite fringe, quite extreme ideas that wouldn't really be picked up by most New Zealanders. And they're highly racist, highly xenophobic, and in some cases anti-Semitic, about where the virus has been developed, if it's been created in a lab, and how it's been spread. And then you can see that significantly changes in tenor August to September. And those origin stories are much more focused on a New Zealand role in spreading, creating, or overemphasizing the impact of the virus and the pandemic for political gain. And this is a really, really concerning facet. It's a radical change in the tone of the narratives over a very quick period of time. So what was going on? Well, we can link some of these stories, these meta-narratives, to features of known conspiracy theories. And one of the biggest and most sort of common known conspiracy theories is that governments or state actors or intragovernmental organisations have a deliberate secret plot, which is, doing something to take power from people or do other things. And what we saw in this conspiracy meta-narrative during this time and ongoingly in the data we're looking at now is that we saw that science and scientists and other experts who had been lined up alongside governments in that kind of positive communication of the infodemic that I displayed to you earlier, were also being associated with these deliberate secretive state acts. And that's of concern because academics and scientists and members of the media and other parts of civil society need to be trusted just as governments need to be trusted. We need to be trusted and trustworthy. So what was happening? There was a key role during that August-September period of what we call narrators. Perhaps we might want to call them super spreaders if we're keeping with that pandemic kind of image. And there was a definite coinciding with the election period in New Zealand and the role of the connection of the election period in New Zealand to the election period in the United States, which obviously is ongoing into today. And we saw in New Zealand, disappointingly and specifically, members of academic communities, members of the media, and politicians alluding to or drawing attention to some of the conspiracies and meta-narratives that were undermining that public trust. And so that was of real concern, that the role of key trusted or individuals in trustworthy type roles in propagating, laundering this kind of information into the mainstream. So we do need to think about, as I said, conspiracy within those historical contexts. We need to think about what it is to be a member of a marginalised community for whom trust in government, trust in the instruments of the state, trust in academia, media and other parts of the arms of civil society might be lessened because of historic experience. And in Aotearoa New Zealand, that specifically means that Māori communities, Pacific communities, and other communities that have differential experiences of either health systems or state interventions are highly likely to have reason to have these narratives resonate with them. So what have we seen post the New Zealand election? It's a bit too soon for me to have done any analysis post-US election, I'm sorry. Well, one of the great things is that we've basically had a large-scale survey of New Zealanders' trust in the current government's processes and plans. And what we've seen is that overwhelmingly New Zealanders support the ways in which we have responded to the pandemic and therefore the ways in which we've responded to the infodemic alongside because of the election on the 17th of October. Looking at the initial data though, what we have seen is that there's been a big uptick of other people talking about New Zealand from overseas. And some people will have seen that on social media platforms, but also in mainstream media and less mainstream media. So last week, immediately after the election, there was a number of different commentators from quite right-wing organisations or groups in the US and in the UK talking about New Zealand as a fascist state, which is really interesting to me as a historian of fascism to think about how that could be interpreted or understood. And that's a really interesting and novel part of the infodemic now, is that change to us being talked about in those ways. And internationally, what does this mean? Why is this happening? Why are particularly commentators and media people in the UK and the US so interested in the decisions that New Zealand has made about the pandemic and about the infodemic? Well, it's interesting to think about the notion of trust in governments. In Aotearoa, New Zealand, historically, over time, we've had quite strong and high levels of trust in government decision-making, and we score really well on transparency indexes and corruption indices. So we are seen externally and internally to be a high-trust society and a country which is transparent and has high-trust political systems. And that has been reinforced through this uptick in discussion of conspiracy, a kind of level of concern that perhaps conspiracy theories were going to become a key part of the election and perhaps in New Zealand's democracy going forward, and then quite a strong signal that that was not really the case, that there was not a lot of support for those ideas politically in New Zealand. But that has coincided with perhaps lessening of trust in other parts of the world, particularly other parts of the world that we are traditionally allies with, like the UK and the US. And so one of the next things that the team want to look at is that discussion of us by other people on social media and in mainstream media. I just wanted to flag for you an interesting piece of research that was done by Research New Zealand, which is a private research organisation, back in September during I think it was still under level 3 or level 2.5 lockdown, where they asked a specific set of questions around New Zealanders' level of belief in conspiracy. And as you can see there, there was a concerning up to 20% level of belief that the virus was manufactured in a lab. Now, obviously, post then we've had the election and the lack of success of any political players who were propagating ideas around the virus being manufactured suggests that this is a little bit of an outlier, and we want to investigate further the ways in which the level of belief can be understood. This is just a little illustration of the kinds of ways in which New Zealanders have also then used social media to sort of refute those ideas that New Zealand is a fascist state. People overtook the hashtag that was created called New Zealand Hellhole and were tweeting back at UK and US and potentially bot interactions with beautiful images of people at gigs and out for dinner and at the beach, you know, all the things that New Zealanders have been able to do because of the level of support and trust in government processes and decisions. So what kind of I wanted to highlight is that it is of real concern that science and scientists have become highly contested in contestable spaces. This is a place where trust has usually been quite high in New Zealand, and it's a feature of sort of the last 15 years. We have in Aotearoa, New Zealand, the Plan B group. We have internationally the Great Barrington Declaration. We've had a lot of contestation of the role of places like the World Health Organization and the United Nations. There's the critical role of New Zealand state agencies and decision making, and all of those have been quite highly contested, both internally and externally. And this is a thing that I think we need to focus on if we're thinking about both issues of national security, but also of trust and reliability in New Zealand's institutions. So in our current work, we're working on setting up some monitoring so that we can report quite regularly on that level of change and the nature change in New Zealand's disinformation landscape. We want to map the social media landscape of disinformation, make those critical connections from the COVID-19 disinformation through to more extreme positions around white supremacism, extreme misogyny, QAnon, etc. And we also want to make sure that we're working directly with communities to figure out what's important to them. So what are we going to do next? Well, we're really, really keen to start this project, which is working directly in the rohi of Ngāti Porou, working with Ngāti Porou storytellers on specific vaccine-related and also other public health and health intervention-related stories. So stories that connect vaccination and other critical health decision-making to culturally competent, culturally relevant narratives about why families, whānau, hapu would make decisions to vaccinate against COVID-19 and other vaccinations. And it's our plan that these will be highly situated and Ngāti Porou relevant, but that in actual fact they'll be hugely useful to New Zealand more broadly as starting points for how to tell stories that resonate with people in ways that are truth-telling and make sense, a pattern making for people, but that this will actually have international relevance too. And so that's the next key piece of work that we're seeking funding for. Here's some contact information. If anyone wants to talk to me further about the project or the work, I've got a link there to the full paper and also to a more public-facing piece that I wrote on the spin-off, describing the nature of the work that we've been doing. And I'd just like to thank Te Puna Matatini and the Ministry of Business, Innovation and Employment for funding this work and continuing to fund the ongoing project itself. Ngā mihi nui ki a koutou. Kia ora.
Thank you so much for that, Kate. It was such a fascinating insight into New Zealand during COVID, and an issue that has been coming up over the last day about what is the power of data, what is the story we're trying to tell, and how to ensure we're telling the right story. So thank you so much for that. There's so many questions and so many valuable pieces for us to take away for what you just presented. Like I've heard you talk a couple of times now. So I guess a question, we've got a couple of minutes. A question that I would ask you is, what do you think the first steps are in terms of, say, from a national security perspective, what is the first thing or one of the first things we need to look at or we need to pay attention to out of all of the trends you're seeing in the space?
I think probably from a national security perspective, the critical thing is making sure that people are aware that there are key links from that COVID-19 disinformation into those other much more dangerous features of disinformation which security services are already aware of. A lot of the same people who will email me or others with explanations of why COVID isn't real will also mention false flag events such as the Christchurch mosque attack. We'll talk about white supremacist ideas. We'll also talk about extreme misogyny. So there are clear links, and we're talking about that. Hema and you and I have talked about that before. But I think that's probably one of the key things. But also, I would like to emphasise that understanding what we did right and are doing right, and the positive parts of the communication and infodemic that we've got right can also work through into those spaces too. So understanding how it was that the Unite Against COVID and the daily stand-ups and the broader communication across communities worked, particularly under level 4 and level 3 back in March and April, will really help us understand what works at a community level more broadly around inoculation against those really extreme toxic narratives.
So thank you for that. Another question I was wondering is, obviously the first lockdown was a national lockdown. And there was something that united us, and there was the story, the team of 5 million, and we all bought into it, and we all did our part. The second lockdown was just an Auckland one. And have you looked at whether that made a difference in terms of some of the misinformation and disinformation that came through?
Yeah, so that's part of the stuff we're working on now. And one of the things about that is that, the two sets of the first wave, because they're still part of the same wave in a kind of in a epidemiological sense. The first part was very much returning New Zealanders who tended to be Pākehā, who were coming back from overseas. They were in their 30s and 40s, bringing the disease back from travel. And then the second wave was our biggest cluster, and it was centred in Māori and Pacific communities across Auckland. So it was exactly what we in Te Puna Matatini had feared would happen, that some of our more vulnerable community members would because of the nature of the works that they did and the amount of travel they have to do to get to work and those sorts of things, be more vulnerable to being infected and then transmitting the virus. And so unpacking the kind of layers of racism and cultural laziness and kind of all sorts of like idioms that New Zealanders use is part of what we want to do. So we're specifically looking at that at the moment. And I think there will be differences. Yeah, it did feel, perhaps for Aucklanders, it felt like we were a little bit more alone. I know that lots of people found the second lockdown emotionally and mentally harder in Auckland. And so we were sort of working with colleagues who were doing those wellbeing pieces of work to draw data from those places to see if we can get a kind of holistic sense of what happened in Auckland in August and September.
Do you want to give a bit of an outline in terms of where do you get the data from to be to tell the story that you've just told us?
Okay, so it's a really, really good question. So most of it's all open. So with the computational stuff, we're mainly looking at Twitter data and any openly scrapable Facebook data. When we combine that with the rich collated data set, which is where we do the discourse and narrative analysis, in that data set we are also taking gifted data. So people will send through to email, which I don't make particularly public because I don't want to start getting huge amounts of harassment on that email. But if people do have some good examples of disinformation, they can email my work email and I'll give them that email. And so people will send us, screenshots of WhatsApp groups they're part of. They'll send us closed Facebook screenshots. They'll send us emails that their mum and dad have sent them that have been sent around, those sort of viral emails that get sent around baby boomers, because we're trying to get a real sense of the breadth and the spaces in which the stuff has been shared. And so that's where you get, I even get screenshots of Instagram stories, because Instagram is a place where a lot of the health and wellbeing discourses take place. And so that is what we call in the business rich collated. So it's not representative because we can't go and look at all of it because it's private, but when people share it with us, we can look at it. The next steps will be figuring out how we can go into some of the more closed groups in an ethical way, and that's an interesting part of the story.
So thank you so much for your time, Kate, and thank you so much for answering these questions.